That's all right.
Hey, Onco PTs, and welcome to this episode of the Onco PT podcast. You know him, you love him. He's back on the podcast to talk about something that is very near and dear to his heart. Welcome, Scott Capozza, back to the Onco PT podcast. Scott, you may be one of the most recurring guests that I've had on the podcast so far. I haven't counted, but I'm pretty sure you're right up there.
Well, thank you. That's quite an honor, and this our friendship has started because of your podcast, and so it's an honor to be here. And thank you, at least for all you do for all onco PTs and for anybody who's trying to get into oncology PT.
That really means a lot to hear, Scott, especially because if y'all didn't know who are listening to this and watching this at home or wherever you're listening to this, Scott was just awarded with a really big award at CSM last month from APTI Oncology, and I want to make sure that we highlight it because I know he will not talk about it. So, Scott, could you please tell us what the award was that you got last month? Because it's a really big deal.
Yeah, thank you. And I thank you and our friends for nominating me for that award. It's the Deborah Fulman-Hoffman Humanitarian Award that is awarded every year by APT Oncology for somebody who displays, humanitarianism in their work, both in the clinic and outside. The backstory is that Deborah was one of the founding members of APT Oncology back when it first started off as a section, when we were first approved as a section in the early 1980s. She was an adolescent and young adult. She was an AYA. Mm-hmm. And unfortunately, she did die of her disease in her early 30s. And so APT Oncology did right by her memory to name this award in her memory. And so that way her memory carries forward even, into the 21st century. So it's humbling and it's an honor that I received this award. So thank you.
Well, it was extremely well deserved. Literally, there's no one else that I can possibly think of, at least right now, who fits that award category so well. So again, congratulations, Scott. We're just so thrilled that you were awarded that, and I'm really bummed that I didn't get to see it this year. I have to tell you, so this is something I haven't told you before previously on the podcast. So I got together a little cohort of people last year, whenever it was, to nominate you, because there's a process. You have to write in emails and letters, etc. But anyways, because I knew you were going to get it, because obviously, who else is going to get it? I was going to print t-shirts with your face on them and have people wear them at the meeting. And I didn't get to go to CSM to make it happen, but I pinky promise someday I will make that happen.
Oh my God. I don't know if that is a good idea or a scary idea with my picture on t-shirts, and that people would actually wear that. I mean, I'm humbled and, forever thankful and grateful to you and to our community, for that. But I don't know that we need people walking around with my picture on their shirt.
Oh man, Scott, if you haven't met Scott, I should just name this the Scott Capozza fan podcast at this point, because I just everyone needs to know about you. But one of the things that I've so appreciated is that you have been such an advocate for so many of us young, new career professional physical therapists who are interested in oncology. You've really made it a very welcoming space. And I think it would be remiss to not make the connections between you and Deborah, whom the award is named for, because you both have turned an experience of your own into your life's work and making it a better, frankly, a better earth, a better planet for people who are dealing with adolescent and young adult cancer. So for the person who is maybe not aware of your story yet, would you mind just sharing a little bit about how you got involved with AYA oncology work now as a physical therapist?
Sure. So I was diagnosed with stage 2 testicular cancer at the age of 22. I was in my last year of PT school when I was diagnosed. And you would say that I didn't fit any of the profiles, right, of somebody who would get sick, who would get cancer. I ran competitively cross country and track when I was at Ithaca College. I didn't smoke, I didn't drink, I didn't do drugs. I also, to the best of my knowledge, had no family history of cancer anywhere in my
Mm-hmm.
family. Like nobody in my family had ever had prostate cancer or breast cancer or colorectal cancer. So not on my radar at all. So completely.
Mm-hmm.
I mean, anybody's blindsided by a cancer diagnosis, and I definitely was blindsided. Uh, so because of the incredible um, community that is Ithaca College, and specifically Ithaca College Physical Therapy, they said, we're going to help you get through this, and graduate on time, graduate with your cohort that you've been together with all these years. But when I graduated PT school, there was no such thing as oncology PT. Like, I
Mm-hmm.
was told, and I think even to this day, to some extent, we're told that cancer is a red flag in general, and we didn't have any kind of connection between cancer and PT. And because of my own, my way of processing my diagnosis, I also did not want the identity. I did not want to be identified. I didn't want people to feel sorry for me, to look at me differently. So I really did not embrace the role of being a cancer survivor for several years. So it took some time for me to kind of grow into that through various different experiences and meeting other people who were also cancer survivors, and then starting to get involved with philanthropic efforts, from the American Cancer Society and others. And I eventually was brought on to be the physical therapist for a brand new survivorship clinic at Yale Cancer Center in Connecticut. And it was interesting because it was something different from what I was doing at that time. I was a pediatric physical therapist,
Mm-hmm.
um, and as I spent more and more time in this survivorship clinic, I saw that there are people who have significant needs physically as well as emotionally and medically and from a nutrition standpoint. So I could try to address as much as I could, in the snapshot
Mm-hmm.
that I had them in front of me in our survivorship clinic. But I also didn't realize there's so much more that we could be doing as PTs. And so that's when I advocated for and went into and started my own position at my hospital to be able to say, we need a full-time onco PT where we're at. And so now I've made this transition, but it did not happen overnight. It really took me years, both as a professional PT, but also emotionally, to be in a place, to be in a space that I can work with other cancer survivors and be comfortable with that myself. Um,
Mm-hmm.
and and I don't share that. At least I don't share that with everybody. Um, I also think that our patients are very savvy, and so they may very well be researching who their providers are. So,
Mm-hmm.
because of your platform and other platforms, people might find out who I am and my history. But it's not about me. It's about the patient who's sitting in front of me and whatever I can do to help them as a physical therapist get them stronger and have a better quality of life. So so that yeah, so my road to doing what I'm doing now as an onco PT did not happen overnight. So that would probably be my first, my first point to anybody listening, especially a student or a new grad, is to say, like, okay, it doesn't have to happen overnight. Sometimes it takes a little bit of time. At least
Mm-hmm.
you're another perfect example of somebody who, you started in a certain situation, and you thought you were in, your dream job, and things changed, and you were brave enough to kind of go out on your own because you saw the needs that needed to be met. um, but that took time, right? Like, that didn't
Mm-hmm.
happen
Mm-hmm.
overnight. That it's like a metamorphosis that we have to go through.
Yep. Yep. It's so interesting you bring that up. I'm coming up on being 5 years as a PT, which is wild. I don't remember that happening. Like I don't remember those 5 years in between then. But just the amount of learning that I've done and the growing that I've done over the past few years to kind of like figure a lot of things out, even in oncology physical therapy. So one of the kind of like learning journeys that I'm on recently is I have a lot of young moms diagnosed with breast cancer who I'm seeing in my private practice. And, just the overlap that it's not that my older patients that I was treating a lot more previously because of just the location that I was in, the patient population. It's not that those older patients don't have issues and challenges outside of the cancer and cancer treatment side of things. We talk about the physical, the social, the emotional, the mental, the etc. Insert domain here that they're having struggles with. But what I've come to appreciate, and it took me a while to get here, is that this younger patient population has that amplified so much more. So, can we back up before we kind of get into those? Because I know we've got quite a few we want to hit today. Can you define what AYA oncology is? So, again, the new listener is kind of oriented to what we're talking about here.
Sure, and it's interesting because the definition of adolescent and young adult is actually it actually varies by country to country. Uh, I know that my co-author, who I worked with on the oncology rehab textbook, is from Australia, and their definition of a adolescent young adult is actually like 15 to 29. So it's a little bit different.
Really? Mm-hmm.
He
Mm-hmm.
in America, here in the U.S., going by the American Cancer Society's definition, it's anybody between the ages of 18 to 39, which is
Mm-hmm.
even still a pretty big age range if you think of how different you are at 28 versus how you were at 18, and how different you
Yeah.
will be at 38. So you can even kind of break down the AYA age range into, like emerging adulthood, like early adulthood, and then like older AYA, so to speak. Um,
Mm-hmm.
but but I think it's because that there are so many transitions within this time frame that's what
Mm-hmm.
we're going to try to focus on today, right? Is that
Mm-hmm.
AYAs are not peds, right?
Mm-hmm.
Pediatrics is is a is its own unique population unto its own that has its own set of needs and specialists to be able to address the needs of a child as they're developing, and to be able to support the family unit during that time when you've got a sick kid. Like, that is a very specialized area of medicine, not just in PT, but in medicine in general.
Mm-hmm.
And then you have your older adults, right? So somebody who's in their 40s, 50s, 60s, 70s, 80s, even older, depending on how old our patients are. Um, and those patients, typically they're partnered, probably have some financial stability because they've been working for
Mm-hmm.
15, 20, 30 years,
Mm-hmm.
um, that sort of thing. And so their concerns are going to be different.
Mm-hmm.
So in the middle is the AYA, and I think that's what we're going to talk about today.
So I am personally in that age range, right? And very like transitional time period. But I don't think we fully appreciate all the different transitions that our patients are going through during this time period. I think one of the most like eye-opening patient experiences I had when I was first kind of understanding like what AYA is and what that means for patients. So I had a young woman who I think was probably like early to mid 30s, diagnosed with breast cancer, and kind of so that was like her medical stuff that was going on, but all the other things that were going on outside of this, She had a family. She had 2 children. She was going to get married. Her mother had actually tragically passed not that long ago before her cancer diagnosis. She was in the process of buying a house. And so, like, there were all these things that were around her cancer diagnosis. And that was kind of the center of the world that I had found her at when she first came to come see me, and talking with her about, navigating all of these different things. Again, young mom of younger children. She's navigating the change in her relationship status. Now she was going from engaged to now getting married, looking at a house together. Now this was pre-COVID, so we're not even talking about housing crisis and all that going on right now. But so many of these different things that we navigate as we're going through this time period, and how cancer and cancer treatment just interrupt and disrupt all of those things, right?
Mm-hmm. Yeah, and that's you're absolutely right. And yeah, she's the perfect example of that. And so again, if you even break it down even more, like you think of like the 18 to 25 range, right? Like a lot of us are in school, right?
Yes.
And
Yes.
so you get, like me, you get hit with a cancer diagnosis. Do you have to withdraw? Do you need, extra accommodations to try to get back to school? You know, so there, and then of course, you're on campus and then you're not on campus for,
Mm-hmm.
a period of time. And people say, well, where did Scott go? Where did Elise go? Like that kind of thing. And how many times can you answer the question? Right. And some people are
Yep.
more open and they will put it out on social media so people are aware of what's going on. And some people are not.
Mm-hmm.
Um, so so right there's a lot of transitions going on, and that, especially at that point, you're not a kid anymore, and so you're trying to strive towards your independence, but you're not
Mm-hmm.
exactly independent because you're probably still using your parents' address. You are probably still on your parents' insurance, right?
Mm-hmm.
So you're not truly independent yet, even though you're
Yep.
striving to get to independence, right?
Yep.
So there's that. And then you've got your 26 to 30 ish, so now you're out on your own, like you're not in school anymore, which is great, like you've done it, you're doing your thing, like you're out, you're practicing, you're getting a paycheck, great. And then your student loans come due,
Mm-hmm. Mm-hmm.
right? Your student loans come due. So, you know, I don't have to tell anybody listening to this podcast that going through TPT school, like you incur a crazy amount of debt, right?
Mm-hmm.
So you now have that expense. You have the expense of an apartment, of your cell phone. Your friends are probably getting married, so you got to fly out to Las Vegas for a bachelorette party, like, right? Like you're laughing, but you've done
It
that.
adds up so
It
quickly,
does,
though.
right? It adds up quickly. And then you get diagnosed with cancer. So now you have all these incredible costs that are
Mm-hmm.
now piled on top of that. You have not just the medical cost of treatment, but you
Mm-hmm.
have all these, what I call these invisible costs. And it's like the death of a thousand paper
Yes.
cuts. You're paying
Yes.
for gas to get to your apartment, or your appointments rather. You
Mm-hmm.
are paying for food. You're probably at the hospital for a couple hours here and there, right? So you got to
Mm-hmm.
buy food. Your patient with young kids may have to pay for childcare so that she can go get chemo.
Mm-hmm.
She's not bringing her kid. You can't bring your kids to the chemo room. As well
Right.
behaved as they are, you're not doing that,
Right.
right? So now you got to pay a babysitter. You got to pay extra for daycare or whatever that
Mm-hmm.
is, right? Um, and one of the biggest things that we see with our young adults, um, is fertility preservation, and how fertility preservation a lot of times is not covered by insurance.
Yes.
And so all these costs just pile up and pile up and pile up. And so there's this concept of financial toxicity.
Mm-hmm.
which we hear throughout the cancer care continuum, right? And it affects just about everybody. The cost of
Mm-hmm.
cancer is in the billions of dollars now,
Yep.
right? You know, it's obscene that there are so many bankruptcies in this country, and so many of them are because of healthcare costs. And cancer is one of the driving factors of that, right?
Mm-hmm. Mm-hmm.
So, and AYAs are the most susceptible to that because they don't have the financial stability of our parents,
Mm-hmm.
right? Our parents have been working for 25, 30, 35 years. They have a savings account. They have a
Mm-hmm.
retirement fund. Like they have like you're 27, you're 28, like you're out of school, like you don't have that.
Right. Yeah.
That's one of the major factors that affects AYAs is financial toxicity.
Mm-hmm. And I really appreciate you talking about these invisible costs because, again, I think we in oncology, even if you're new here, like you know how much chemotherapy costs. I think everyone's familiar with, like they've heard the news story about the chemotherapy that costs $50,000 a dose, et cetera, right? So we know that cancer and cancer treatment are very pricey conditions to have. And I feel like pricey is downplaying just how expensive it is, right? It's astronomical. It's egregious how much it costs. So, like, okay, we've established that that's already expensive enough, and there's copays. We're not even going to get into all that. But these invisible costs, these things that we don't have, like, we don't normally think about, and maybe like we as the physical therapist, especially, like, we may not be appreciating all of these things that the patient is having to pay for in addition to or because of their cancer diagnosis and their cancer treatment. Again, going back to childcare, my older patients, my 70-year-old who's been diagnosed with cancer, they're not having to rearrange childcare situation. They're not the ones most of the times who are caring or the primary caregiver for a child. They're not trying to balance maybe scheduling between a spouse or a partner and trying to say like, okay, can you watch the kids? Can you watch the kids? Not even considering like single parents who are raising children by themselves. Maybe they're in a house that they own, maybe they're renting. It kind of depends these days, and putting education on hold. But one of the things that we haven't really talked about yet, Scott, and I would really like to spend a little more time on, is how this affects AYA patients when it comes to jobs
Mm-hmm.
and that kind of financial perspective. Can we talk a little bit about that?
Yeah. So again, if you're out, and you've been working someplace for, a year and a half, 2 years, that sort of thing, you don't have the seniority of somebody who's been there for 15, 20 years, right? So all of a sudden you got to go for chemo, you've got to go for radiation, like you've had a major surgery, and you're not like you're a nurse, right? Like you're a critical care
Mm-hmm.
nurse, like you're a NICU nurse, right? Like you work in the hospital, but you got to do patient transfers, and so but you just
Yep.
had you had a bilateral mastectomy with deep reconstruction. You can't do any heavy lifting for
Right.
weeks, so you got to take that time off. And so you better hope that you got a manager who's going to be understanding to be like, oh yeah, sure, you can do, some more, administrative kind of things until you're cleared. And even when
Mm-hmm.
you're cleared, like
Mm-hmm.
you're not strong, and that's why you got to, that's where we come in. So there's that. And then the other side of it is for AYAs who have to, you know, take time off, maybe they have to, leave their job so that they can get treatment. Somebody needs to get a bone marrow transplant or something like that. And they just know, okay, I just know I need to like take a break from working so I can focus on my health.
Right. Right.
Well, now all of a sudden they got a gap in their resume. So like you were working, for a span of time, and all of a sudden you got this like year and a half gap in your resume. and you go for an interview, and your employer says, "Well, what did you do during that time?" And you don't necessarily want to disclose that,
Mm-hmm.
right? Because it's like, well, I don't want them to think that I was, traipsing through the Sahara or the Himalayan mountains or something like that. But I also don't want them to know necessarily that I have a cancer history,
Right.
right? I mean, before we had ACA, like you would be paying more for insurance because of a
Mm-hmm.
pre-existing condition. Like, so
Mm-hmm.
I never disclosed that early on because I didn't want to have my employer say, "Oh yeah," and so then it goes to HR, and I got to get charged more for my insurance because I got a pre-existing condition.
Yep.
So there's that, and then even further still, you were doing a particular job that was pretty physical, and now
Mm-hmm.
you've had a sarcoma, or you know you've had a cancer that's spread to your brains, and you've had a brain metastases, and now like your functional impairment is really functional mobility is really impaired,
Mm-hmm.
so you can't do the job that you were doing before.
Mm-hmm.
And again, you've only been working for 3 to 5 years. You don't have the financial means to support yourself for very long in a situation like that, and now you're scrambling to say, well, what am I going to do now? Like, what am I going to do for work?
Mm-hmm.
What am I going to do for income? How am I going to pay off
Mm-hmm.
those medical bills and still pay off my college loans, right?
Yep.
And pay for my
Yep.
rent or my mortgage and keep my internet and, all of those things.
Mm-hmm.
So, yeah, so return to work is such a challenge. Like, time off from work is such a challenge for AYAs.
One of the things, so this is related. I'm going to take a quick step to the side. What I listened to a podcast called Financial Feminist, and it's great. But one of the things that she really talks about a lot, because again, very much like her demographic is not like AYA survivors, but is that age range, right? And one of the things that this host talks so much about is savings and compound interest and all these things. And so, one of the things that's really important for the listener to take away from this conversation we're having with Scott today is it's not just a temporary disruption in their ability to earn money, to save money, to advance in their career. This has ramifications on potentially the rest of their life. We get the physical impairments, right? We're very familiar with, like cardiotoxic side effects of doxorubicin. Okay, we get that. We talk about that all the time. But this is so critical, and it's something that I really did not appreciate for a long time, is that this is not just a temporary disruption. This sets people back potentially years to decades, maybe necessitating that they have to work much longer than the average American would like to when it comes to like retirement age and whatnot. I mean, it's just this cascading effect that we don't always think about.
Yeah, and there was an article that was just released in the Journal of Clinical Oncology, and it talks
Mm-hmm.
specifically about the cost at AYAs and the earnings that they lose.
Yeah.
It's in the
Yeah.
hundreds of thousands of dollars over
Yep.
there because we hope that they're going to have decades of life ahead of them, which is
Mm-hmm.
great.
Mm-hmm.
But because of time lost from work and playing catch up all the time,
Mm-hmm.
because their financial growth, right? And we're just talking financial growth right now. We haven't even
Right.
gotten, we'll go back to the emotional growth in a minute, but the
Yeah.
financial growth has stunted because of this cancer diagnosis occurs when you're at your most critical time in your life to try to establish your financial stability.
Mm-hmm.
It's in the hundreds of thousands of dollars.
Yeah. It's so crazy to think about, ideally, like none of this is ideal, let's be clear. But a lot of my patients, my younger patients, when they're diagnosed with breast cancer, it's usually like a year to a year and a half kind of process from start to quote finish. Although, like, even it's kind of
Yeah,
a loose
finish. It's
finish
a
at the
soft
end, right?
finish.
Finish.
Yeah.
It's a year and a half of time, which in the grand scheme of, average life expectancy of Americans is like 74-ish years old. But that year and a half, again, if we're lucky here, has decades to a lifetime of long-term effects on this person's ability to do what they want, what they need to do with the people that they love. And it's again, like, I feel like it took me so long to wrap my head around just how widespread and long lasting these effects are for this particular patient population. And that's just the financial side of things, right? Like you said, we haven't even gotten to some of the other challenges that this patient population can face compared to our older cancer survivors.
Mm-hmm. Yeah. And so that's, yeah. So, and I think that's something you're right, because, and I think we'll get to this in a little bit, but, you know,
Mm-hmm.
not that we're doing this intentionally, but we want our patients to come see us for Onco PT, right? But if they got to pay a copay,
Mm-hmm.
right,
Yeah.
then that is just, you're just rubbing salt in the wound, so to speak, right?
Mm-hmm.
It's like, we're gonna get you better, right? Like, we want you to come see us twice a week for the next 8 weeks. Well, if your copay is $50 a pop, really, are you going to be spending $800? Do you have $800 just laying around in your pocket when you're already like trying to figure out how you're going to pay next month's mortgage?
Mm-hmm. And on top of, if you have to arrange childcare,
Mm-hmm.
you're like, that's a cost. The cost
Yep.
of gas, like you talked about
Yep.
to get there. Yeah, it adds up so quickly.
Yeah. And there was a great article that was released a couple years ago by Lauren Gazal and team about crowdsourcing
Mm-hmm.
in AYAs, and about how AYAs more and more have to turn to GoFundMe pages and that sort of thing because of all of this. And for some of our AYA patients, that's okay, because
Mm-hmm.
they put it out on social media. They are okay sharing that information. And that's great for them. But I had a patient who was 28 with breast cancer, and she actually, I mean, she had this app where she could add up all of her treatments. Not that she paid for all this out of pocket, but the cost of her, again, and it's not just the chemo and the radiation, it's the hormone therapies, and it's every time you have to go
Mm-hmm.
get a you get the Neulasta injection put on your arm. It's every time you've got to
Yeah.
go get a Zometa injection, like all those things, right? It was over $1 million, which is
Oh my
crazy.
God.
So her roommate started a GoFundMe page for
Mm-hmm.
her, and she hated it because she's like,
Yeah.
I don't want to be outed. Like, I don't want people to know all about this. I don't want people knowing all my
Yeah.
business. And
Yeah.
so, that's the thing that Dr. Ghazal and her colleagues said in this article about crowdsourcing, is that it's a blessing and a curse. That's an exact
Right.
quote. A blessing and a curse. Yeah, it's a blessing because people are contributing money to help me pay for all these costs. But it's a curse because I don't want this out there.
Right, right. And I think it does, like of course, every patient is different. Everybody has different ways that they process this. But for some, there is a concern about, now that this information is out there, does that diagnosis kind of precede me as a person, as far as, I mean, again, we talked about jobs, trying to get a job. Um, but also there's, I think some people have to consider, like, at this time period, we talked about transitions, dating and relationships and what all that looks like. I mean, honestly, thank God I'm married, because I could not imagine dating these days. But having that potential, like, do I disclose this diagnosis with a potential partner? When do I disclose this? Like, at what date do I tell this person that I'm a cancer survivor or that I'm undergoing cancer treatment? And I think that kind of, again, like, I feel like if you sit and you just marinate on this and the potential kind of rippling effects of all of this, I mean, you could just kind of get into a spiral about just how much this really affects a person.
Mm-hmm. Yeah, I like that visual, the ripple effect, that the cancer diagnosis and the AYA, like, you know yeah, you throw the rock into the middle of the lake, and then you just see how it disperses throughout the lake. It's not just one part of the lake; the entire lake is affected, right? The
Mm-hmm.
financial and the the psychosocial and the emotional and the physical, and but it's all the same lake,
Right.
right?
Right.
Yeah, I mean the whole that whole idea of, do I bring this up on a first date? Do I not bring this up on a first date? Like, all the body image concerns that are, intertwined with that, right? Am I good enough?
Mm-hmm.
Right? Am I damaged goods? Am I scarred for life? I mean, I am,
Mm-hmm.
I have scars. So like what's going to
Right.
happen when somebody sees that? Um, you can hide most of them, but at some point, you know you're gonna disclose that,
Right.
and so that is so hard. And again, older adults, I mean, I know older adults have to deal with that too on some level, but if you're already in a relationship, and you have a solid network of friends, like you've got your people,
Mm-hmm.
and then if you're a child, obviously yes, you have your own concerns, but you're not necessarily thinking about dating, right?
Mm-hmm.
And finding
Mm-hmm.
a life partner, and or are you with the partner, and will my partner stay with me through
Oh,
all
yeah.
of this? Will
Yeah.
my partner still find me attractive
Mm-hmm.
when I have no hair and I have a
Yep.
port in, and
Yep.
or I have a colostomy bag? I mean, all of the things,
Mm-hmm.
right?
Mm-hmm.
So, and yeah, so that's another thing, which then that all leads to that AYAs are more susceptible to anxiety and depression.
Mm-hmm.
And that's something that we have to be cognizant of, not just our social work colleagues, but us as PTs as well. We have to be listening for those cues of, are our patients, are they depressed? Are they struggling emotionally because of this? And for us to be able to offer empathetic listening, to the best of our ability in that moment, but then think about, okay, do I need to contact the social worker within my hospital network, or do I need
Mm-hmm.
to start thinking about, like, for you at least, in private practice, like who's in my community that I can
Mm-hmm.
connect to this person with? What are the
Mm-hmm.
credible online resources that I can connect to this person with? Because anxiety and depression is so prevalent in this population.
Mm-hmm.
And right there, dating, body image, fear of missing out, that all snowballs into this avalanche, which is anxiety and depression.
Mm-hmm. Mm-hmm. I really appreciate your comment on the finding credible online resources. I mean, at this point, it's no longer a like, oh, maybe your patient will go online for some help. No, I mean, with the accessibility, I mean, again, thinking about like how easy it is to just,
Mm-hmm.
open up an app on your phone, open up a web browser on your phone and start looking for information. Our patients are going and finding this information, especially with as tech savvy as this patient population that we're talking about is. Like, the world is at our fingertips as far as resources, but there's a there's quite a few. I'm not going to say a lot, at least that I've encountered, but I've encountered a few kind of like questionable resources. So I think having the mindset of our patients are already going online looking for information, whether that's intentionally or unintentionally. But if we could almost like get ahead and maybe offer some different resources on, like, here's something you may consider. Maybe this is something that you would benefit from. I know here in Fort Worth, there's an AYA coalition that I'm getting plugged into. But Scott, for the listener who's, maybe not in a big city, or maybe is just not aware of different AYA resources out there, what are maybe some tips you would give them to start finding some of these groups and networks that we could get plugged into, but then also get our patients connected into?
Yeah, that's a great question. So I've even found that even within that, like you can like kind of funnel people based on like where their needs are. So I
Mm-hmm.
feel like, first of all, just like the sense of belonging, right? Like anybody with a cancer diagnosis, like, you have to have a sense of like, where are my people at, right? And it's like,
Mm-hmm.
this is the perfect example. Like the AYA is like, where are my other 20 somethings, early 30 somethings who are going through this, right? And
Mm-hmm.
so stupid cancer has been around for at least 15 years now, and they are great because they have, on their social media platforms, they tell you about all the different support groups that they have, right? Like they
Mm-hmm.
have a men's only, they have a LGBTQ group, they have all these different, like even subsets. Um,
Mm-hmm.
they even have they have an aging out of AYA, which is I kind of find myself in now.
Oh wow. I never
It's
thought
like,
about that
okay,
before. Yeah.
yeah, I'm like, I'm not really 40 anymore, so like, but I was diagnosed as an AYA, and I've got, AYA concerns, even though I'm not,
Mm-hmm.
in my 30s anymore. So it's like,
Mm-hmm.
that doesn't go away. It doesn't go away when you turn
Right.
40. So,
Right.
um, so yeah, so stupid cancer is great. And so they have a lot of really, and a lot of their meetups are facilitated by clinical social workers.
Mm-hmm.
So right there, you've got credible people, licensed professionals who are, coordinating and serving as moderators for these chat rooms. Okay.
Mm-hmm.
So that one is great. Elephants and Tea is a great one because they allow the AYA to express their emotions and their feeling through different writing options. Like they have like different, they have a journal and they have different themes. Like the next theme is like, fear of missing out. The next theme is, parenting as an AYA. Like,
Mm-hmm.
and so they say like, write to us, like write a blog, like write an essay, like and then we can put it together in this um, digital newsletter, right? So it's very
Mm-hmm.
cathartic that, that they have that platform in place.
Mm-hmm.
So that one is really great. Going back to our point a few minutes ago about work in the AYA,
Mm-hmm.
triage cancer is really great because they help you with going back to work. They help you with disability insurance. Like they help you answer all of those questions. And again, it's very
Mm-hmm.
geared towards AYAs. Um, and then, you know, one of my favorite ones that I was able to to be able to experience myself. For us, we want our patients to be as active as possible. We want them to be as physically
Mm-hmm.
active as possible. Yeah, is First Descents. And First Descents, again, has been around at least 15 years, maybe coming up on 20 years at this point.
Mm-hmm.
And the idea with First Descents is that they want AYAs to be out living it. So they provide these amazing free outdoor excursions, and again, only for AYAs. Like you've got to
Mm-hmm.
be diagnosed between the ages of 18 and 39 to be able to qualify to go for this thing. And they have them all over the country. Like you can learn how to surf in California. Like you can go rock climbing in Moab. You can go whitewater rafting down the Snake River. Like, and they in the food, the lodging, like the hiring of the guides, all that is free. All the AYA has to pay for is travel. That's it. You just have to get there, and then the
Mm-hmm.
rest of that experience is free. And it is great because it's a great opportunity to be outside and to be physically active. And then at the end of the day, you have dinner and you sit around the campfire and y'all kind of like tell your stories. And so it's kind of like a support group without calling it a support group.
Yeah.
So, um, if I can share my experience real quick, um, I got to go rock climbing in the Hudson Valley in New York. I was still a little squirrely about flying, but I was able to drive to that one.
Mm-hmm.
And apparently the Shigunk Mountains in New York, like they're like a really big climbing place in the climbing world. And so we had guides, and we're all roped in, and we're belayed, and we got to wear the helmets and the whole nine, and it was hard. It was definitely outside my comfort zone. I'm used to being on the bike. Like going one direction. And I could control that. Like this was different, but it was great, and it was just so fun to be able to be on that excursion. Um,
Mm-hmm.
and so yeah, so there are these credible resources that are out there to support the AYAs emotionally, and making these connections, helping financially. Maybe two more if I can um, talk about quickly. The other good one about peer-to-peer connections is Immerman Angels, who was started by a testicular cancer survivor himself, Johnny Immerman.
Mm-hmm.
And they were doing virtual connections before virtual connections were even a thing. So, you can say, okay, yeah, I am 25 years old, I was diagnosed with testicular cancer. I had chemo. I did not have radiation, and I am, and I'm really big into playing horseshoes. And they will find somebody who matches you pretty closely.
Oh my god, that's so cool.
So yeah. Um, and then one of the other ones, for financial assistance,
Mm-hmm.
is an organization out of Boston, called the SAM Fund, also
Mm-hmm.
founded by a young adult survivor, who again realized that the challenges of trying to finish school and establish your career, is challenging, and so they have these need-based scholarships that people can apply
Mm-hmm.
for. Usually, the application process is like February, March, I believe. But that's another one that you can look up that has a really good resource for AYAs.
And I will link to all of those in the show notes for those of you who are frantically taking notes. I got you, don't worry. Um, there is also one more resource that I want to make sure that we can talk about. So we've talked about patient resources, like how can we get connected with these places, these organizations? How can we connect patients with these organizations to address some of this very specialized needs, very specific needs that they have? But if you're wondering, Elise, how do I treat patients that fall into this AYA category? Scott has you covered, because Scott and I, this past summer, had a lovely little time in Seattle where his family kindly adopted me for an afternoon because we were in there filming courses for MedBridge. Scott, can we talk about your MedBridge courses? Because these are perfect for the therapist who needs this information.
Yeah, that was such an incredible experience, and somebody that we both look up to and admire, and is a giant in the oncology PT world. Nicole Stout was the one that was able to connect us with MedBridge to be able to record
Mm-hmm.
those sessions. Yours on immunotherapy and radiation therapy are incredible.
Oh my God, thank you.
So it was so great to be able to be there at the same time doing those. Um, yeah, I was able to record um, two specifically on AYAs for MedBridge. One was kind of an AYA foundational, get to know who the AYA patient is, and again, everything that we've talked about why the AYA population is different from peds, it's different from the older adult population, and talked
Mm-hmm.
about financial toxicity, what's contributing to financial toxicity, and the increase in anxiety and depression, and some of those resources there. And then the second one I did was on the rehab needs of AYAs, and talking about, again, a young woman with breast cancer is probably going to get a very similar oncology treatment plan as somebody who's in their 40s, 50s, or 60s, but they may be getting dose dense,
Mm-hmm.
and They may need to undergo ovarian suppression, which means that you
Mm-hmm.
just thrust this 33-year-old into menopause,
Mm-hmm.
which means now, on top of everything else, we got to be worried about her bone health, that we just
Yep.
threw this 33-year-old into menopause,
Yep.
right? Um, and again, like, to be able to talk about, for us as PTs, like, so that the copays don't become a barrier to access to rehab. Like, what are the workarounds with that? Like, how can we be more
Mm-hmm.
creative in our rehab approach? So, one thing I talked about was telehealth, right? Like, if you're able, if people can't take time off from work and they can't find daycare for their kids, and the parking, is ridiculous, right? And so you
Mm-hmm.
can eliminate all of those, costs right there by doing a telehealth visit. I mean, maybe you easily save this person $100, even though you still have to charge them for your visit, right?
Mm-hmm.
Fine, but you may have saved them $100.
Yep.
And if you do that over the course of 6, 8 treatments, you just save that person $800,
Mm-hmm.
because they don't have to come see you in the hospital. They don't have to pay for parking. They don't have to pay for food. They don't got to pay for gas. They don't have to do any of that, right?
Mm-hmm.
So there's one strategy there. I think, to be able to, again, find our credible exercise resources that are in the community, the Live Strong exercise classes that are at the
Mm-hmm.
YMCA's, again, is a free resource to all of our cancer survivors, but we want to make sure that our AYAs know about that.
Mm-hmm. Mm-hmm.
So, again, like, if they want to go back to the gym, and we are encouraging them, that we want them to exercise and get into an exercise routine. But yeah, gym memberships are another cost.
Mm-hmm.
If they can do this Livestrong program, they get a free 90-day membership to the Y, in addition
Yep.
to having a structured, supervised exercise class. So,
Mm-hmm.
so those are some of the things, to think about, making sure that our AYAs are aware of, as far as what we can do, you know, as far on for rehab.
Mm-hmm. One of the things, Scott, that I'd like to kind of wrap up with today is, as a still newish physical therapist in the oncology space, especially when I was brand new to kind of being aware of these different rehab needs of AYA survivors, it can feel very overwhelming to, I'm sure, hear this information and think, oh my God, there's so many things that these patients are dealing with. How do I even start assessing for them? How do I screen for them? What do I know to screen for? Like, how do I know I should be screening for these things? What piece of advice or encouragement would you give the newer therapist, the newer onco PT who's starting to work with the AYA survivor patient population?
Probably the most important thing that you can do is listen, and then listen to what they're telling you, listen to their living situation. Who do they live with? How far away do they live? If they're being treated at a cancer center or at a hospital, how far away do they live? Like, all those types of things first. And then, over the course of your assessment, kind of ask, you know how are you doing at home? Like, what is your support network like? Those kinds of things. And you may not be able to get all that information in the first session. So, you know,
Mm-hmm.
Elisa, you can agree that what we do is very intimate in some
Mm-hmm.
respects. That we are really focused on that person, and
Yep.
like, people will tell us lots of things, and people learn to trust us, so we can, they can start to open up, and so we can continue to ask, like, you know, again, what's your support group? Like, how are you taking care of yourself outside of here? Not just
Mm-hmm.
physically, but emotionally, and, what other support systems do you have? And do you need any help?
Mm-hmm.
Right?
Mm-hmm.
Say, what else can I do to help you? Not just helping you with your range of motion, and not just helping you with your balance, but, like, what other resources can I help you with to help you make this confusing, confounding situation known as cancer easier.
Mm-hmm. Yeah. Yeah. And one of the things I'm curious if you feel this way too, Scott, I've found the more I practice, again, had some practice doing these things, but patients will tell you things even when you're not asking them, as far as like, you may not be asking an explicit question about something, but if you're listening and you're listening for those things, sometimes you get that answer. And that can kind of prompt me to then dive deeper and be like, okay, so what I'm hearing is kind of this and this. Can we talk about this more? Or, oh, I'm hearing this. Well, what about this kind of deal? That's something that I feel like I'm getting a little better at, is kind of picking up on those cues of like, maybe it's not said explicitly, but I'm starting to pick up that, oh, you know what? I think this is an issue that we need to talk about.
Yeah, and I think, yeah, and even like I've learned, especially over these last 3 years, to read people's eyes,
Okay.
right? So it's like, you know, again, like I have a young woman, who is partnered, but when I asked like, who do you live with, and she said, oh, I live with my partner. I was like, oh, okay. So there's something more
Mm-hmm.
there, right?
Right.
The
Right.
the little eye roll is like, oh, okay, there's something going on there. And so, not that
Mm-hmm.
I necessarily need to bring it up in my first visit, but the second or third visit, like I'm going to start like, so, like, tell me a little bit more about, you know, and to then realize, oh yeah, like because of her diagnosis and because of her surgeries, like they're having all of these relationship issues, and so it's like, oh,
Mm-hmm.
okay, well, are you connected with a social worker? Are you connected with, somebody like at our hospital? We have a sexuality, intimacy, and menopause clinic that specifically addresses the sexual health concerns of our patients. And so
Mm-hmm.
it's like, oh, okay, like because patients again, like they don't know what they don't know, and so like we may be the
Mm-hmm.
ones, maybe we're the gatekeepers, right?
Yeah.
To be able to share that information with them.
Mm-hmm. Yeah. Scott, thank you so much for this amazing interview. It's always fun to bring you on the podcast, obviously. That's why I keep having you back. But this is such a cool topic to talk about. And like I said, I don't feel like I really appreciated how layered this patient population can be, how dynamic and specific and specialized their needs are, until I started really kind of working more with this patient population, frankly, by accident. Do you ever have those time periods in your practice where you have these waves of patients that you're just like
Mm,
seeing the same patients, not the same patients, but like the same presentations, same diagnoses, same impairments at one period of time? Do you ever
mm-hmm.
get that?
Oh yeah, yeah, yeah. It's like all of a sudden you get a whole bunch of patients who have a history of thyroid cancer. It's like I think I
Yes.
saw two over the span of like a year, and now all of a sudden within 6 months I've had like a dozen.
Yep. Yep. So that was how it was for me within my first, I think, year and a half of practice. I all of a sudden just had a ton of young moms diagnosed with breast cancer, and it was like, what the heck is going on here? Which, that's a whole other conversation. But I think having that very intensive, like, multiple patients every day, you just start to pick up on trends. And I know that can be really frustrating for the newer therapist who's like, I need help now, kind of deal. So, like, yes, it comes with practice, but again, if you're looking for help now, Scott has these amazing courses available on MedBridge. I will link to them, of course, in today's show notes. They're incredible. It's definitely a labor of love, and I'm really, really excited to get to share these with my audience. So go and take Scott's MedBridge courses because they're really good.
Yeah, and maybe as a parting thought there, at least that, yeah, you're right. For a new grad or somebody who's out doing this for the first time, and they start to see this patient population, again, being present is probably the most important thing that you can do. You know,
Yep.
yes, it can be overwhelming, but that patient in front of you is even more overwhelmed,
Yeah.
and
Yep.
so over time, as you create that relationship with that patient, then you can kind of dive into that. And again, you don't have to have all the answers. None of us have all the answers.
Mm-hmm.
So, if you're able to amass some of these, resources, your tools in your toolbox, so to speak. And it's like, oh, okay, yeah, I'm not the best at, this, but I know that this person is, or I know that this,
Mm-hmm.
this website, this organization is really good at this. Like, maybe check it out. Like, actually, go ahead, check it out. And then when I see you next week, tell me about it because I want to know about it too.
Yeah. Yeah. Again, Scott, thank you so much for coming on the podcast. Congrats on your recent humanitarian award. It was well deserved. Nobody more deserving of it than you. And we're just really excited to continue seeing what comes your way. Could you, for the person who maybe wants to follow you on social media, because you post a lot of good stuff, where can they find you?
So I'm on Twitter and on Instagram, and I am at Scott Capozza, just straight up my name, no
Great.
hyphens, periods, no nothing.
Perfect. And I will, of course, link to that in the show notes. So thank you again, Scott, and have a great rest of your day.
All right. Bye, Elise. It was so good seeing you.